but of course another period where people were attacked, their mental health was attacked, their whole psychology was attacked, was in lockdown. So welcome to today's news, Diane. What have you got to tell us about the Scottish COVID inquiry?
Hello, Brian and Ben. Thanks, Brian. Yeah, so we need to be doing some coverage, I think, over the next period, actually, about both COVID inquiries, both in the UK and in Scotland. But I think Scotland in particular, they have let some things slip out that maybe the government wouldn't have wanted to be slipped out. But let's look at this a little bit. And what I plan to do over time is some more in-depth analysis of the hearings and the transcripts and the witness statements that are coming out. But we have a long way to go in getting through the inquiry. So first, let's look at, according to the Scottish COVID inquiry website, what is a public inquiry? So we're pretty clear here that it can investigate what's going on, but it is also expected to report on its findings and make recommendations for improvements in the future. So what we're saying here is, well, next time we have a pandemic, I'll put that in inverted commas, we don't want this to happen again. No, of course we don't. So what exactly is going on with this inquiry and what are they doing? If we look at the terms of the Scottish inquiry, they've done it separately from the UK inquiry, and that's because ministers in Scotland had devolved powers that were different in some ways, or in addition to what happened in the UK. And so, for example, the administration of vaccines was some of it was devolved and some of it was UK wide. For those of you who lived in Scotland, as I did during the 2020 to 22 period, we know that the restrictions were much stricter up here in Scotland than they were down south, which was very, very difficult for people, not for the reasons of a deadly virus, but for the reasons of the isolation and the other consequences that we all experienced through that time period. We see in the next slide here that the inquiry is now going into its next phase. Even though this covers the period from January 2020 to the end of 2022 for the so-called COVID period, we have now just moved into our permanent hearing space in July of 2024. So we're just getting started. Obviously, we now have a permanent home. So who knows how long this is going to last for, investigating what happened to a small country. There are ways if you could get involved in the inquiry at different levels. We see here core participants, which have a wider range of responsibility in terms of looking at the evidence, looking at anything that's provided in advance in writing. There are 3 themes within the inquiry. The first one has just been completed earlier this summer, which is health and social care. There are 2 more to go, so we're only about a third of the way through the hearings if we want to look at it that way. I am interested in contributing to the one on education in young people because I saw firsthand the detrimental, terrible effects it had on the university students that I was directly responsible for. For example, when I had to deal with their suicidal feelings, some of them were wanting to take their own lives because they were stranded in residence halls. And I could not do anything as a university program director other than send them an email address. I couldn't even send them to a counseling office or even give them a phone number for campus counseling services at the time. So for me, that was really difficult. And so obviously, even more difficult for the students who are losing their youth on being locked up in residence halls and other places. But that all said, there is a man called Dave, the independent researcher. His X handle is Biology Phenom. So I would encourage all of you to go and check out the extensive video clips and evidence that he's been collecting. Unfortunately, it's really hard to summarize video clips because there are so much of them and so many transcripts, but this is what I'm going to hopefully be working on over time. So we have just a couple of minutes here summarizing some of the findings from this first stage of the inquiry from Health and Social Care. If we could play that video, please.
We anticipate the inquiry will hear that people were pressured to agree to do not resuscitate notices, that people were not resuscitated even though no such notice was in place, that residents may have been neglected and left to starve.
So yeah, he did know because it terrified him.
Right. And do you know if he was asked once or if he was asked on a number of occasions?
5 times.
5 times. 5 times that night? Or
5 times within 24 hours.
Aye, that's what I says to him. I says, my mum's no dying of COVID. My mum's dying of starvation and dehydration. By the next winter, we were back to square one. There was lots of people not getting in. There was lots of people who were... they'd really get into isolating people really badly that year. I mean, that was terrible. There was people being isolated for... People were coming in the group saying, my mum's been stuck in her room for 45 days.
I got a phone call from the care home to say that my dad was failing. He was agitated, he'd been shouting for help, he'd been wandering into other rooms, so he was still mobile. They'd found him on his hands and knees trying to get to the toilet. I was then told they were going to introduce end-of-life medication, which would be midazolam and, if needed, and morphine, and I was shocked.
I've ascertained that the sedative that she was given is one called midazolam.
That's correct.
And we've heard about midazolam from other witnesses, and I think it is associated with end-of-life care.
She was also given 2 other drugs that were part of an end-of-life protocol. The funeral directors was the ones that says to me, they says they used to have a thing called like a cremation form 4 or something. If they had an issue with the cause of death, which was on the death certificate, then they would get in touch with us people or whatever, they'd tick a box. And I asked them directly, I says, if you still had the forms, if they still existed today, because they done away with them, they stopped doing them, I says, would you have ticked that box to say that you've got a concern with the cause of death of my brother's death certificate? And he says to me, yes.
I'm personally not convinced my mum had COVID.
So definitely some evidence that a lot of us know, obviously, anecdotally from what happened to us and from other people we know. My father-in-law was a midazolam death in 2021. My mother died of, she was on a ventilator in 2021. I wasn't allowed to see her because she died in America and I wasn't vaccinated and I wouldn't test. So we know about these detrimental effects on families and people. And I'm certainly not discounting anything about what people are saying in the testimonies, but I think what we do need to look at is what is the actual scope of the inquiry? What can an inquiry do to hold people to account for what did happen, other than just saying, oh, let's not do that next time? And how much is it costing the Scottish taxpayers? If we go to the next slide, we can see here the cost from the start of inquiry, so assuming that was sometime before the 31st of March 2022, up until the 30th of June 2024, has been a total of £26.1 million that has been spent on the inquiry. And as I said, we're only about a third of the way done, at least when it comes to the hearings and the things that are, coming out of that and all of the work and the staff and so on. I've had a lot of discussion about this on X the last few days. And if you would like to get involved in this conversation, please follow me on X. My ID is DIANEUKC. So that's Diane UKC. We see some different ranges of opinions about the inquiries. Alex Mitchell, who we've worked with before on the UK column, has said, okay, so we have such a small amount of the claims for the vaccine injured, both in England and in Scotland, that are getting awarded vaccine damage payments because the vaccine damage payment scheme is so terribly limiting, but yet we're spending millions on these inquiries. And I've said myself, well, if we look at the fact that we know that there weren't excess deaths in 2020, but the excess deaths actually started once we got into the vaccine rollout in 2021 and going forward, that the fact that they're still calling this a pandemic investigation is a problem for me, because to me it just expands the narrative that there was a pandemic when we know it was actually, vaccine damage and isolation and midazolam and other things that actually killed people. I would just like to call out once again, Dave, Biology Phenom. He has a Substack here that has a lot of other, in addition to the video clips he's put on Twitter, he has extensive information on his Substack as well. So I don't have time to go into all of it, obviously, but I would encourage everyone to check that out to see what he's actually uncovered, which has been quite substantial. And again, I will continue to do some formal sort of analysis of some of the transcripts and the witness statements and report on those in the coming months, Brian.
Diane, thank you very much for that excellent segment. To me, there can be no doubt that the government has been attacking elderly people, and they've simply been cold, in my opinion. And if the government is prepared to do this with the elderly, they're prepared to do a lot more with the younger living. It is time for people in this country to really understand the venom that now exists amongst politicians, many of whom simply will still not tell the truth.